Good afternoon, ladies and gentlemen. I'm Banakhar, and I would like to start by thanking the ICS organizing committee for this virtual conference and for giving me the chance to present my paper, which is mainly about the effect of Botox in neurogenic Detrusor overactivity with. We all know that intravesical Botox is already FDA approved for neurogenic Detrusor overactivity, and the commonest side effect is UTI and retention. Post-procedure UTI reach up to 48%, with the highest being with a dose of 200 international unit. But what will happen if the patient is already having recurrent UTI? This is actually the aim of our paper, to study the effect of intravesical Botox injection in neurogenic Detrusor overactivity patients who are already having UTI. So we designed our prospective cohort study for patients who receive Botox injection and who are already having neurogenic Detrusor overactivity with recurrent UTI. Patient data were collected, including diagnosis, Botox dose, and urodynamic finding pre and post injection, and they were followed for the incidence of UTI developed after Botox injection in the early 6 months after the procedure. Results: we had a total of 93 patients who were diagnosed as neurogenic Detrusor overactivity and symptomatic recurrent UTI. The diagnoses were spina bifida in 58 patients and Hinman syndrome in 35 with a median age of 22. 58% of the patients received international unit of 300 and 41 received the 200 dose. After receiving Botox injection, 75% of the patients had no more or decreased the incidence of symptomatic UTI. The urodynamic test post-injection showed increase in bladder volume at the first uninhibited bladder contraction in 65% of the patient and increased bladder capacity in 79%. Correlation analysis showed significant correlation between resolved UTI post-Botox injection and patient diagnosis, presence of hydronephrosis, and post-injection bladder phyllic pressure with the sig value. So we found that the incidence of urinary tract infection decreased after Botox injection in neurogenic overactive bladder patients with recurrent UTI, and accompanied with improved dynamic parameters. We concluded that intravesical Botox injection may decrease incidence of symptomatic urinary tract infection in neurogenic Detrusor overactivity, and this effect seemed to be related to maintaining low pressure.